To understand what psychothymic disorder means, some background information on bipolar disorder is needed. Bipolar 1 is the most severe form of manic depressive illness. Manic depressive illness affects not just how a person thinks and reacts, but also how that person behaves and feels physically. Many factors can cause bipolar disorder, but genetics play a big role. To be diagnosed, there has to be signs of at least one manic episode and a depressive episode. A manic episode is a 1 week of elevated or unusually irritable mood. Bipolar 2 is depressive episodes and hypomania. Hypomania is a mild version of mania. Mania is marked by periods of great excitement, euphoria, delusions, and overactivity. Feel very up or high, have a lot of energy, have increased activity levels, feel jumpy or wired, have trouble sleeping, talk really fast about a lot of different things, irritable or touchy, feel like their thoughts are going very fast, think they can do a lot of things at once, do risky things like spend a lot of money. A depressive episode may feel very sad, down, empty, or hopeless, have very little energy, have increased activity levels, have trouble sleeping, they may sleep too little or too much, feel like they can't enjoy anything, feel worried and empty, have trouble concentrating, forget things a lot, eat too much or too little, feel tired or slowed down, think about death. Defined by numerous periods of hypomanic symptoms as well as numerous periods of depressive symptoms lasting for at least 2 years, 1 year in children and adolescents. However, the symptoms do not meet the diagnostic requirements for a hypomanic episode and a depressive episode. The disorder is a chronic and impairing subtype of bipolar disorder. Largely neglected in pediatric research, consequently, it is rarely diagnosed clinically despite potentially being the most prevalent form of bipolar disorder. Lack of attention has added to the confusion about the diagnosis and clinical presentation of the cyclothymic disorder. The causes of the cyclothymic disorder are unknown. Major depression, bipolar disorder, and cyclothymia often occur together in families. This suggests that these mood disorders share similar causes. Cyclothymia usually begins early in life. Men and women are equally affected. Symptoms may include any of the following: periods or episodes of extreme happiness, high activity, mania, low mood, or depression for at least 2 years. Mood swings, ongoing symptoms with no more than 2 symptom-free months in a row. The diagnosis is usually based on your mood history. A healthcare provider may order blood and a urine test to rule out medical causes of mood swings. It can take a while to find the right medication and dose. Everyone responds to medication differently, so many patients have to try different drugs before finding the one that works. Once they do discover the right drug or drug cocktail, it may still take some time to determine the optimal dose. In the case of mood-stabilizing medications such as lithium, the difference between a beneficial dose and a toxic one is small. Frequent office visits to reevaluate the medication needs and careful monitoring of the symptoms and side effects will help them stay safe. During mania or depression, most people talk with their doctors at least once a week or even every day to monitor symptoms, medication doses, and side effects. As they recover, they will see the doctor less often. Once patients are well, they might see the doctor for a quick review every few months. Common side effects of lithium: weight gain, drowsiness, weakness or fatigue, excessive thirst, increased urination, stomach pain, thyroid problems. Less than half of the people with cyclothymic disorder go on to develop bipolar disorder. In other people, cyclothymia continues as a chronic condition or disappears with time. Therapy gives the tools to cope with life's difficulties, tracking progress, and deal with the problems the disorder is causing in personal and professional life. Getting regular exercise can help stabilize mood swings. Exercise is also a safe and effective way to release the pent-up energy associated with manic episodes. To keep symptoms and mood episodes to a minimum, maintain a stable sleep schedule. It is important to regulate darkness and light exposure as these throw off sleep-wake cycles, and they also upset the sensitive biological clock.
It's great. It's the roller coaster ride of your life. And then it dies.
Many months later. $3,000 years later.
So we fall in this kind of middle yet still uncomfortable realm of highs and lows. Never major highs or major lows. We kind of float in and out. And that's also why this goes undiagnosed all the time, because for a lot of people it's somewhat manageable. And I use quotes because it's still not good, but we can kind of tolerate it. Okay? So that's how we diagnose it. And I think it's important to note, you don't meet the criteria for MDD, but you meet the full criteria for hypomania. Okay, so we're going from hypomania to dysthymia. And I want to also note, and I'm just reading from what I wrote down here, that if you also meet the criteria for borderline personality disorder, that's fine. You can have both. They can happen simultaneously. And this is often comorbid, meaning happening at the same time with drug and alcohol abuse, because, like I said, people tolerate it okay, they do okay, but they usually self-medicate. And so it's often that we find people with cyclothymia struggle also with alcohol and drug abuse. Okay? So that's what it is. That's how long it has to last, and that's kind of what it feels like.